Today we talk about a big question that comes up in almost every IVF consult. Should I do ICSI?
I'm Dr. Mark Amols, and this is Taco Bout Fertility Tuesday.
Whether you're in the middle of an IVF cycle, or maybe you're going to be going to an IVF cycle, at some point there's going to be the question of should you do ICSI? Now, for some clinics, this is optional. For other clinics, they make everyone do ICSI. And the question is, should you do it? Is ICSI really worth it? And when is it just an extra add-on? Well, let's start first with what is ICSI? ICSI, ICSI, stand for intracytoplasmic sperm injection. That's a mouthful, but the idea is pretty simple. Instead of putting sperm with thousands of sperm on top of the egg, instead we pick one sperm and we inject it directly into the egg. Now what's interesting is this isn't something that's been around for a long time. Matter of fact, in 1992 was the first time it was performed in a successful IVF cycle. Interesting enough, that's when I met my wife. Unbeknownst to us, we were going to have fertility problems, specifically my sperm, and if it wasn't for ICSI being created when we met each other, we wouldn't have kids. So thank you, Dr. Palermo. But what's interesting is ICSI isn't just for people who have low sperm count. There are other times you would use it. For example, egg freezing wouldn't even be possible if there wasn't ICSI. And that's because when you freeze eggs for future use, the egg's zona pellucida, which is the shell on the outside, will actually harden. And so there'd be really very little way for the sperm to get into with natural fertilization. So without ICSI, we wouldn't even be able to freeze eggs, which is pretty profound thinking how many people freeze eggs now, and it wouldn't be possible because you wouldn't be able to fertilize them later. Another situation where ICSI is going to be needed is in what's called PGTM, which stands for monogenic disorders. In that situation, you don't want to have a lot of sperm around the eggs because when you go to take a biopsy of the embryo later, those sperm are still stuck in the zona pellucida. They're kind of just left over from earlier. And so when you take that biopsy, you could actually get some of those sperm and could cause the results to be inconclusive or potentially unable to differentiate between real disease and possible contamination. So clearly, ICSI is very important. It is something that has changed our field tremendously. But ICSI was developed for severe male factor. But this is common. Sometimes something made for something can be used for other things, just like IVF. IVF was made for women who had blocked fallopian tubes, whereas now a lot of IVF is done for other reasons. But as ICSI has grown and is used for more than just male factor, the real big question is, should everyone be using ICSI? And the answer is very simple. No. And that's where the guidelines help. Now, when we look at the American Society of Reproductive Medicine, also known as ASRM, there are some clear-cut cases where ICSI is absolutely recommended. So the first one is going to be male factor infertility. Anytime the sperm count is going to be low, or the sperm are not moving very well, or there's concern that it's not going to be able to penetrate the egg due to, let's say, very low morphology like 0 or 1%, which is the shape of the sperm, saying that only 1% of the sperm have that perfect shape, then ICSI is going to be used and it will be a game changer. The other situation would be whenever you retrieve sperm. A lot of people don't realize, but when you retrieve sperm from the testicle, the amount of sperm you get is actually very minimal. And so you cannot do artificial inseminations. You must do something like IVF because you're going to need ICSI to inject the sperm in due to the small quantity of sperm you have. Now, the other two areas that we talked about were one was PGTM. That's a situation where you're looking for a disease and a stray sperm could contaminate the sample and would not lead to clean results, and potentially the results wouldn't be reliable. So it's a common time to use ICSI when you're doing PGTM. The other situation we talked about was frozen eggs. Frozen eggs tend to have a harder outer shell. And so ICSI allows us then to inject the sperm in to allow people to have success with their frozen eggs. Another situation that's absolutely supported by the ASRM is a prior fertilization failure. Meaning when you go through IVF and they put the sperm on top of the eggs, if none of them fertilize, then ICSI is going to be recommended next time because there's obviously some type of issue between the sperm and the egg that prevented it from fertilizing. There's this saying, once ICSI, always ICSI. Meaning, if you've had FELFERT and you've used ICSI, you're just going to always do it again. You're not going to expect the sperm to somehow be better. Think of it like my Arizona Cardinals. I love them, but I expect they're never going to really get better, so I'm eventually going to die before they get a championship. That's how we look at sperm. Once it's done bad, we just assume it's always going to be bad. Now, it's not unreasonable if, let's say, you did something to correct the sperm and you want to go back to standard insemination, where you just put the sperm on top of the eggs. It's not unreasonable. Talk to your doctor, but what I would tell you is, if you've ever had FELFERT, pretty much every time in the future, no matter if with another clinic, you should be recommended to continue with ICSI. So those are pretty clear indications of when ICSI should be done. But where is ICSI debated? Well, per the ASRM, routine ICSI in non-male factor cases doesn't improve live birth rates. So what this is saying is that clinics who do it all the time, no matter what, technically shouldn't be doing that because it doesn't benefit the patient. Matter of fact, it even kind of lowers your chances a little bit because standard insemination usually does have a better fertilization rate than ICSI. Matter of fact, I'm astonished how some clinics make everyone do ICSI and then also make you pay several $1,000s for it. At our clinic, we do give the patient a choice, but there are times we'll tell them they need to do ICSI and that we would not recommend doing standard insemination. Now, it doesn't make these clinics wrong who require everyone to do ICSI. There is a reason why they do that. And that reason is because it lowers the risk of failed fertilization, which really is one of those rare things that can happen, but when it does, it's devastating. Imagine you're someone who's coming from, let's say, another country, and you come to the States to do IVF, maybe for something like gender selection. And you go through and the sperm looks good, they do standard insem, nothing fertilizes. When you think about that, think of everything you had to do to come to that clinic, come to another country, and nothing fertilized. That's the reason some people will do ICSI for everyone. Now, I don't think you need to. I think you can look at the situation and determine who are the best ones to have it. It doesn't mean I can't be wrong. I have been wrong before. But what I'm saying is that there are situations that just kind of make sense to do ICSI in. So for example, let's say you've been together for 10 years and you can't find anything wrong and you haven't got pregnant. Technically, you shouldn't do ICSI. However, I'm going to recommend ICSI every time. Why? Because I don't have a reason for why you aren't getting pregnant. And so in my mind, I'm wondering, could there be some type of issue with fertilization? Now, you don't have to jump in all the way and say, okay, we're going to do ICSI. You could say, well, listen, let's do 70% ICSI and 30% traditional. That way we can figure out if there is a problem with the fertilization. Another situation is going to be where there's very few sperm. So for example, I'm not saying that there's not enough sperm. What I'm saying is that let's say your partner had cancer and you have one vial of sperm left. Technically, you can just thaw that sperm and do it as standard insemination, but you don't get a lot of tries. There's not endless supply of that sperm now because it was frozen prior to their cancer treatment. So in that situation, I would recommend ICSI because I would want to use a little bit of the sperm by chipping some of it off, doing IVF, and then you can do multiple cycles. Now, for most clinics, when they're not doing ICSI as a standard, what they'll do is they'll usually do a small semen analysis on the day of to verify there isn't something wrong with the sperm. Just because your sperm has been good on prior semen analyses does not mean on the day of the retrieval that you can't have a bad day. We do that same thing, and then the other thing we do is we do a morphology test. If we notice one of those are wrong, then what we'll do is switch you over to ICSI as long as you've consented for us to do that. When I've had patients put no ICSI, and I know they need it, I will talk to them and say, listen, we will not do ICSI, but I highly recommend you do it because I'm concerned you're not going to have fertilization. And I've had patients say, nope, we don't want to do ICSI. And just like I suspected, their fertilization was poor. So the point there is talk to your doctor. They've seen a lot of these cases. And so if you're at the clinic that does allow you to choose, it's very important to talk to them. Don't listen to me. Don't listen to some Facebook post or some other group. Talk to your doctor because they know your situation best. Now, the next topic is what happens when it doesn't fertilize. You probably heard you could do rescue ICSI. And so if you can rescue it and do ICSI, why do you need to even try ICSI to begin with? Well, that's a great question, because if that was true and you could just do rescue ICSI and you could help any egg that didn't fertilize, no one would start with ICSI. The problem is rescue ICSI is not as good as doing ICSI, meaning if we could take 10 eggs and those 10 eggs are exactly identical, and one of them you did ICSI from the beginning, the other 10 you did ICSI after they failed fertilization, what you would find is the ones that you did after failed fertilization will do much poorer. And when I say poor, I'm not talking about lower fertilization. I mean the quality of the embryos will be poorer. The pregnancy rates when you do implantation will be poorer. The grading of the embryos will probably be lower. It might be called rescue ICSI, but really it should be called Hail Mary ICSI, because in reality, you're already in a bad situation, and now you're just trying to turn a bad situation into an okay situation. So the point of that is never rely on standard INSEM because you think you can always do rescue ICSI. Rescue ICSI is a Hail Mary. If you need ICSI, you do it from the beginning. So let's bring this all together. Let's talk about the pros and the cons. So the pros of ICSI. 1, it's going to solve fertilization problems and male factor causes. 2, essentially you need to use it anytime you're using surgical procedures to retrieve the sperm. 3, if you're doing something like PGTM, it helps keep the genetic testing accurate because it prevents contamination from other sperm. 4, when it comes to freezing eggs, it allows us to fertilize the eggs with a high success, which makes then egg freezing possible. And number 5, it can prevent repeat heartbreaks if you had fertilization failures in the past. Now, let's talk about the cons. Well, one of them is extra cost. At our clinic, we actually don't charge that much. It's about $500, $600 we charge for ICSI. But there are clinics that can charge $2,000, $3,000. And like I said, it actually surprises me when they force you to do it, how they can force you to pay. Now, that's me on my soapbox. Obviously, people have to charge for what they have to charge, but it's just something that's always bugged me. At my clinic, on the first time we did it, they did this. I thought it was frustrating and had to pay for something that we didn't even have the choice to use. Now, technically, I had bad sperm, so we had to use it regardless. One of the other cons of using ICSI is there's technically slightly more manipulation of the egg. We get worried about things like embryo biopsies, where we're taking 3 cells from like 100 cells. But when you think about it, you're sticking a needle into 1 cell. If that cell dies, it's over. If you take 3 cells from an embryo that has 100 cells, that embryo is going to be fine. So we give so much concern to biopsies because we think, and they're like pulling the cells out. But in reality, ICSI can be very dangerous. And for some patients who have very fragile eggs, the eggs can actually die at the time of fertilization, or even the next day we come back and then they die. So there is some manipulation of the egg that could potentially hurt your eggs. And so that's why you don't want to do it just to do it. The third thing when it comes to cons is going to be there's actually no benefit when the sperm and the eggs are normal. So we have normal sperm factor. There's no other reason, like you haven't been trying them for 10 years, then using ICSI doesn't really benefit you. And as I said, you could technically say it might be a disbenefit because your fertilization rate would be lower, whereas ICSI is around 70% and standard insemination is closer to 80%. So that takes us to the final point, and that is the question we asked from the beginning. Should you choose ICSI? If it's one of those 5 reasons we talked about, male factor, sperm that's been retrieved through surgery, you're doing genetic testing such as PGTM, you're using frozen eggs, or you've had failed fertilization, absolutely. In the situation where you don't have any problems, should you do it just to prevent not getting fertilization? Well, that could be a costly mistake. I'm not going to lie. If I'm traveling across state to a clinic, and let's say I'm only getting 1 shot at this, I may not want to take the risk and say, yeah, I want to do ICSI. But if I'm someone who's older, who might have fragile eggs, maybe I don't have that many eggs, and I have no reason to do ICSI, as scary as it may sound, it would be better to do standard fertilization because remember, complete failed fertilization is very uncommon. So unless some of those situations for when you should do ICSI are known, and none of those apply, the routine use of ICSI isn't proven to make a difference. And ASRM doesn't recommend it for everyone. That doesn't mean you can't do it, and that's where I go back to the point, talk to your doctor. When I am trying to make that decision, I'm looking at it from multiple perspectives. Not just, is it needed because of criteria, but I'm looking at the whole picture. How long have they been trying? Has that person ever had proven fertility? What if the guy's sperm is perfect, but I found out the last 3 partners he's had never got pregnant? I'm going to be worried about something. And even something as simple as just coming from another country. When I have someone coming from another country, I almost always do ICSI. Because why? Because if it fails, it's tremendously going to be a problem. They have to come all the way back from another country just to be able to do IVF with us. So for me, it makes sense in that situation, even if it's just a minor issue, to push them towards ICSI. That's the reason we make it just a very substantial cost, because we don't want anyone not to do it because of cost, but we also don't want people just to do it. And if you're at one of those clinics that makes everyone do it, ask them why they recommend it for you. I can guarantee you they have a reason, and that's the point. Always talk to your doctor. ICSI is one of the most powerful tools we have in modern fertility treatment, but it isn't a one-size-fits-all solution. Hopefully this episode is able to help you determine if that solution is for you. And if you think it isn't or is, talk to your doctor. And they may agree, or they may disagree, and their reasoning may be right, but you need to talk to them. If you found this episode helpful, please tell your friends about it. Tell another friend who might be going through the same thing. But always tell people about us. Give us a 5-star review on your favorite medium. And as always, keep coming back. I had several people send me messages to tbft@newdirectionfertility.com about some future episodes, which I'm going to be putting together. Thank you for that. And I encourage others to do it as well. I can assure you, if you're questioning something, someone else is too. I look forward to talking to you again next week on Taco Bout Fertility Tuesday.